You must learn that what you have been taught are just nutrients are actually some of the most potent medicines you will ever use. As an example, vitamin E slashes the risk of heart attack. Cambridge University says that the consumption of vitamin E can reduce the rate of heart attack by 75%. Is there a single drug on the market that can reduce the rate of heart attack by 75%? Why isn't your doctor giving you vitamin E? Doesn't know is the right answer. Vitamin E slashes the risk of heart attack. Included 2,000 individuals, all with heart problems. Over an 18-month period, half were given vitamin E and half were given a placebo. Heart problems in the vitamin E group was 25% of the placebo group, a 75% reduction. Not a small study, not 10 patients, 50, but 2,000. Scientists said that vitamin E was far more effective than such current treatments as aspirin and cholesterol-lowering drugs. I can give you data on nutrients such as B6, carnitine, CoQ10, cysteine, folic acid, etc. on heart disease also. There is no reason to have heart disease in this day and age of such knowledge, but it continues to be the #1 killer. How much do you have to take of vitamin E? This study concluded that the ideal minimum was 400 units per day. The ideal minimum. That didn't say that some people couldn't take more. The ideal minimum daily requirement to stop heart disease was 400 units per day. And I heard someone say, well, doesn't vitamin E thin the blood? Yes, but the beautiful thing is that vitamin E helps to thin the blood when it's too thick, but it doesn't thin it to the point that it leaks through your blood vessel walls. It doesn't cause bleeding. I don't care how much you take. I have given 2,000 units a day to many patients. We've never had a problem with leaky blood vessels. You've got a question way back there.
What's the difference between naturally and manufactured E?
Vitamin E is sold in a variety of ways. D-alpha, DL-alpha, succinate, etc., tocopherol. Let's just say that the best information as of this point is that pound for pound, synthetic or manufactured vitamin E is 1/2 as potent as natural vitamin E. In general, you are always better off to get a vitamin E that is based in, that comes as a natural concentrate that has the other tocopherols other than alpha tocopherol, has beta, delta, zeta tocopherols in it. Because now we're finding uses for some of the other tocopherols. We always thought that they were just there. But nothing is just there in nature. Okay.
So take alpha or take meds?
You can take alpha. Billions of people. The study was done with D-alpha tocopherol. That's okay. Yeah, the oil capsule in general, but you can now get oil-soluble vitamin E in a powder form. So it, you know, the technology of today has gone a long way since I started in this industry. Here's a Harvard study. 88,000 nurses. That's a bundle of nurses, isn't it? Studied for 15 years as to the incidence of colon cancer. Those who took a vitamin supplement with just a tiny 400 micrograms of folic acid had a 75% lower rate of colon cancer. Arginine. There's just been an absolute explosion of interest in arginine in the research world. take 20 years for it to hit the doctor's offices, but 3 to 14 grams of arginine inhibits the growth of cancer cells. And for those of you who are interested, the famous Jimmy Keller remedy, Tumorex, was arginine.
What about selenium?
Selenium is very, very important. A great researcher down in San Diego, Dr. Schrauser, says that if we gave our kids 200 micrograms of selenium a day, there would be an 80% reduction in all cancers. 80% just with that. Just think of what if you gave them a little bit of everything. Instead, do any of you, are you on the internet? Any of you play on the internet?
Oh, yeah.
24 hours a day if you want to listen to me, if you can stand it that long. Yeah, www.letstalkhealth.com. Letstalkhealth.com. You need a computer. Yes. Okay, I'm going to say good day. I thank you all for such a great one. Thank you very much. God bless.